Well, the current estimate is that 17% of United States population in the United States has sleep apnea. I would say it's much more than that. Dr. John Remmers of Harvard, the physician scientist that really coined the verbiage of sleep breathing disorders. When I read his articles and his work, and believes that 70% of the issue and problems comes from the bimaxillary retraction of our jaws, meaning that both our upper and lower jaws are going back. And this we have known in dentistry, in orthodontics, we have known this for the last 250 years. When we compare our cephalometric x-rays, which is our basic measuring tool or analysis, tool of analysis and diagnosis in orthodontics, to the x-rays of the skulls from 400, 500, 600 years ago, we see that our jaws are going backwards. And that there is good reason for it. There is a number of different, both environmental and social reasons for it. Just to briefly mention it is, the more industrialized we have gotten, the more polluted our environment has gotten, the more breathing disorders that we have. And it all goes back, goes to our airway issues with breathing freely through our noses. The more industrialized we have gotten, the more processed materials that we have in our foods. You just go to any store now and pick up any food. I dare you to pick any can or any materials, even in fresh markets, that you think you're getting all these fresh vegetables or all of these. The way we are producing or mass producing products, there are processed and chemicals involved in the process that our bodies were not designed to break down. We just don't have the ability to break these things down. And so what happens in our kids, as children, we end up having a lot of mucus and anywhere from a mild to a very aggressive kind of allergies. I mean, think about how many kids today have allergies. Okay? Another reason is that less and less mothers, I think probably there's a move back to it now, but fewer and fewer mothers are breastfeeding. It's extremely important in the development of dental arches, our jaws, our development of the strength in our tongue, to breastfeed our children. We know for a fact that children that are breastfed, they have less incidence of allergies. Okay? So again, all of these go back to have a freer, more patent or more open way of breathing as a kid. Now, when we look at this and we look at the whole picture of the person, the patient that comes in, the origin of most TMJ issues are the same things. So when I started treating TMJ patients, I started realizing that, wow, there is a huge correlation. 70% of my TMJ patients also have sleep apnea. So this reduction or retraction of our jaws, what it's doing is taking all of our tongue and all of our musculature right into our airway, and that's encroaching on our breathing. So early in the stage, we have early stages in the life, we have breathing issues and mild allergies, and maybe we're not correctly breathing, and I see parents, my child is just snores a little bit, it's not a big deal. It is a big deal. If you listen to Dr. Remmers, he says nobody, no adult or child should make a noise. Breathing even heavily is abnormal.